I'm going to talk today about endometriosis and adenomyosis. So, did you know that endometriosis approximately affects 1 in 10 reproductive age women worldwide? What is endometriosis? It's a condition where the endometrial cells, which should normally be lining the inside of the uterus, grows outside the uterine cavity. And so that can be on the bowels, on the ovaries, the fallopian tubes, the bladder, and even deep within the muscle of the uterus itself. That's what leads to adenomyosis. Symptoms of endometriosis can include cyclical pain, especially right before or during a period. And typically this is pretty severe pain, not just the normal mild cramping that you might get during your menstrual cycle. Other symptoms, because endometriosis can affect the bowels and the bladder, might include issues with urination or nausea, vomiting, constipation, or diarrhea. Also pain with intercourse, because what happens is endometriosis inside the belly can cause scarring, and that scarring causes your organs sometimes to stick together and then causes pain. And for some women, this also contributes to infertility. Not all patients with endometriosis will have fertility issues, but there is a much higher risk in patients with endometriosis that they will struggle to conceive. Some people with endometriosis actually don't have very many symptoms at all, which is what makes diagnosis of this condition sometimes very difficult. In addition, there's not always obvious physical signs of endometriosis. For example, there's no blood test that you can do that will tell us if you have this condition or not. Oftentimes, an ultrasound will be done, and if we see cysts on the ovaries called endometriomas, then that is pretty indicative of endometriosis. However, many people can have completely normal imaging tests, but still have the classic pain associated with endometriosis. In those instances, the diagnosis is made clinically based on symptoms. The only way to truly definitively diagnose endometriosis is through surgery, where we would go into the belly, take biopsies of the tissue that looks like endometriosis, and confirm that under the microscope. Obviously, we don't recommend everyone do this just for the purpose of diagnosis. So again, most cases are made just by symptoms alone. It's important to advocate for yourself. If you think that this may be a condition you have, make sure that whoever you're seeing as your gynecologist or your primary care doctor is taking you seriously and doing all the things that they could do to evaluate if this is an issue. Let's talk about adenomyosis. What is adenomyosis? This condition is on the same spectrum as endometriosis because it's, again, abnormal endometrial tissue, but now it's specifically growing within the muscle of the uterus, such that when you have a menstrual cycle or when you bleed, that tissue is also bleeding into the muscle itself and can cause severe pain. It can cause a sense of fullness or that you have a mass in your belly. And that's because with adenomyosis, the uterus tends to be quite enlarged compared to normal. Again, just like endometriosis, the symptoms may be similar, and it may also be very hard to diagnose. There is typically more obvious ultrasound findings for endometriosis. However, again, there is no blood test for it, and often we try to correlate symptoms with ultrasound findings. Ultimately, again, the only way to definitively diagnose adenomyosis is to do surgery and to actually remove the uterus and look at those cells under the microscope. Again, we don't obviously do this just for the purpose of diagnosis, but for some women, if they are done with childbearing, that may actually be the treatment for their discomfort. Now, what is the treatment for adenomyosis or endometriosis? They're very similar actually for both conditions. And some of it depends on whether you're trying to get pregnant and want to preserve fertility, or if you're done with childbearing and you just want to treat the symptoms. If you really just want to treat the condition itself, many patients start with pain medication to see if that by itself could help manage. Oftentimes, because endo and adeno are hormonally driven, specifically by estrogen, hormonal pills such as progesterone or even medication that suppresses the estrogen production can help decrease that impetus to worsen endometriosis and adenomyosis, which can improve symptoms. And then often the last resort, if this medical intervention does not work, is surgery to either ablate or cut out the spots of endometriosis or adenomyosis, or sometimes remove the ovaries or uterus altogether. If someone is trying to conceive, then a lot of those interventions that I mentioned before are counterproductive to trying to get pregnant, so you wouldn't necessarily want to go on hormonal suppression or do surgery to remove organs. In that case, the goal isn't necessarily to help address the pain or the symptoms, but rather to help you conceive. And many times during a successful pregnancy, those symptoms will actually get better on their own. Now, what fertility treatment options are there for people with endometriosis or adenomyosis? It's the same as any other patient, but typically IVF is the better option since both endometriosis and adenomyosis could affect issues with the fallopian tubes, egg quantity and quality, and endometrial receptivity. It's important to talk to your doctor about all of the options and to figure out which one is the right option for you. Ultimately, if you do have endometriosis or adenomyosis, remember you're not alone. You are in good company since so many women do struggle with this. And by no means does it indicate that you're never going to be able to be pain-free or not have children. There are treatment options and different modalities to help. Remember to always be an advocate for yourself, especially if you feel like your current doctor is not hearing or understanding your concerns. It's also important to find a fertility specialist if you are trying to conceive that will take into account this condition and talk to you about the different strategies that might be beneficial for you in your fertility journey. Also remember that more than just the physical manifestations of endometriosis and adenomyosis, because it's related to pain and not always very obvious signs of the condition, there is an emotional toll to this, especially if it's layered on with infertility. So there are a lot of support groups out there, especially now in social media, the internet, where you can find other people that have gone down the same path as you. I highly encourage you all to seek those out. And again, look for providers who are going to be supportive of you and that condition. Remember that this is a condition that, even though it may not always be able to be cured, it can be managed and overcome to a degree. So never give up. And if you want more information on endometriosis and adenomyosis, continue watching these videos or check out our website, which also has great information.